Hello friends, this is Devendra Soman from Nisargaherbs. I welcome you all to Nisarga Talks. Today we are going to speak with Dr. Abhishek Mahajan, who is an orthopedic surgeon. So he's basically a joint specialist and he's a specialist in sports therapy. So let's wait for him to get online and then we can begin. So I see people have started joining in. Varma ji, welcome. Sawan sir, welcome. Rashmi ji, welcome. We'll just wait for Dr. Mahajan to be online in a minute. As soon as he's online, we'll start our program, okay? It's nice to see you all being very punctual and being here online at 5 o'clock. Thank you so much. So today's session we are going to do in English because the last few sessions we did in Marathi and we got a lot of comments. There was a lot of appreciation as well, but there were a lot of comments that people wanted to see this session in English again so everyone can understand what is going on. So Dr. Mahajan is here. Let me just bring him online. Hi Lisa, I hope you're doing well. Thank you for joining in. Hello, Dr. Mahajan. Good evening. How are you doing today? Yeah. Could you just
Hello, good
turn
evening.
your
I'm fine, thank
phone
you.
the other way because I'm seeing you on the other side. Yeah, this is much better. I hope
Yeah,
it's not an issue. Okay, so we'll just give Dr.
yeah.
Mahajan a minute until he sets up his
No,
system.
that's fine.
So let me just introduce you to him. So he's a musculoskeletal and joint specialist. He has done his MBBS, MS, DNB. He's a fellow of International College of Surgeons. He's a fellow of American College of Surgeons. He has a fellowship of Royal Society of Public Health from UK. He's a fellow of CHA Bandang Medical Center in Seoul, South Korea. He is a fellow of Dinanath Mangeshkar Hospital in Pune. He is also an author of 14 publications in national and international journals, as well as he has an MBA in hospital management. So, Dr. Mahajan, welcome to Nisarga Talks. I am very glad and grateful that you gave your valuable time to us
Yeah,
today.
thank you.
So,
Thank you. It's my pleasure. Uh, so
Yeah.
everything is
Everything
fine. You
is
can see me,
perfect.
hear me?
So one thing I would like to tell you is how the
Okay.
format of
Yes, yes,
our
yes.
talk is going to be. So we have
Yeah,
collected a few questions from our customers
yeah.
and from people who watch this talk every week. And we'll go through those questions
Okay,
as well as in the meantime, if someone from the
okay,
audience who is watching us live has a question, then I will be asking that to you as well.
okay. Yeah,
Not
Devendra, I
really.
can't see you.
I
Is there
can
any
see
problem
you
from your
and
side?
let me
Just,
just check. Just give me 1 minute. Can you see me now?
yeah, yeah, yeah. Hear you well.
Can you see me now? Okay. Can
No, I
someone
cannot
from the
see you.
audience let me know if you can see Dr. Mahajan because he's the star of today's show. So it's okay if you can't see me. As long as you see him, I think that solves our purpose. So uh, Actually, I don't know why, because I can see myself. So let me just see. Okay, can you see me now?
No, no, no. I think someone from the audience should let us know whether they can see both of us.
Okay, this is very weird. Anyway, so let's start with the program. I see a lot of people are already on the show, so I don't want to shut it down and then restart it. But I will be here
Yeah,
as
yeah,
long as you can hear me. I will be on the show.
yeah, yeah.
So,
That's all right.
Dr. Mahajan, first question for you. How
Yeah,
would you describe the
uh,
mechanism? Yeah,
yeah, yeah.
yeah,
Yeah, Devendra. Yeah, Devendra. Yeah, before we start, first of all, I would like to tell
yeah.
the audience that the other day I was reading about nisargaherbs, and if I'm not wrong, one of your products is
Yes,
undergoing
yes,
trial
doctor,
for
that is
COVID
correct.
immunity, right? Yeah, so it's a matter of great pride for like all citizens of Satara that our own company is into this, and I wish all of you
Thank you so
like
much,
success
doctor.
ahead in the
It
trial.
means a lot when you say that.
Yeah,
So thank you so much again. And for everyone hearing, I'm glad that the
yeah,
doctor community is proud of the work that Nisarga Herbs is doing. And thank you, Dr. Mahajan, for that. So let's begin with our program. So yeah, people are saying that my video is invisible, which I don't understand what is going on. But anyways, so let's start. So Dr. Mahajan, how would you describe the mechanism of joints? What happens when we start to age? So as we progress in our life, how are joints actually in place and how they start deteriorating, or what changes happen as we age?
yeah. So you'll be surprised that the many things we see in our day-to-day life, they're inspired from the actual human body. Okay, for example, when you open a door,
Okay,
there is something called as a hinge, right? So there is something known as a hinge joint in our body. Okay, and probably in engineering, those who are in engineering
right.
involved in some engineering work, they know what is a ball and socket, right? So there is something known as a ball and socket joint. So the types of joint in the body, they are similar to the things which we see in our day-to-day life. So the most common joints in the body, they are hinge joint. Okay, so I have a model of a knee joint here. So hinge is basically, it works in this single plane. Okay, so this is the bending and this is straightening. Okay, so this is something known as a hinge joint. Okay, and the most prominent example of hinge joint is knee and elbow. Okay, and then we have something known as a ball and socket joint. Okay, so this is a model of a hip joint. So this is the pelvic bone and this is the thigh bone. Okay, so the thigh bone rotates around the pelvis in a motion of a circle or 180
Okay,
degrees. Okay, so that is a ball and socket joint. So the most prominent example of ball and socket joint in our body is the shoulder joint and the hip joint. Though there are 7 to 8 types of joints described, but the most common problems involved in my day-to-day practice, or most common complaints from the my patients, they are regarding these two types of joints. That is hip, knee, shoulder, and elbow. Okay, and the spine joints, they are a little bit different because they are all. This is the model of spine. Okay, so
okay,
all the joints, they are plane, so it is known as a planar joint. So these are some of the types of the joints. And when you see any joint, okay, the basic structure remains the same. Okay, so explaining this on this knee model. So this is the bone. Okay, there is an inside layer inside this joint. There is a layer known as cartilage. Okay, so cartilage is a very smooth layer inside of the joint, and it helps in maintaining
okay,
the smooth movement which we experience. So the initial stage of arthritis, when the patients develop pain, okay, as they age, is the destruction of this cartilage. So what happens? Cartilage prevents the joint
right.
ends, that is the bones, from rubbing against one another. So whenever the cartilage is destroyed, the bone rubs against one another. To give an analogy, when you rub two stones, okay, the movement which is experienced by you is the similar experience which is felt by the patients whose cartilage is completely destroyed. Okay, so the as regarding to your second part of the question, so during aging process, the cartilage gets destroyed and the bone ends get exposed, and then they
Okay.
rub against each other, causing pain.
Okay. So basically, the cartilage is what deteriorates as we age, and that is what causes changes in how we walk and
Yes,
everything
yes,
else,
yes,
right?
correct.
Okay. So then, what is
Yeah, yeah,
arthritis, and how do
yes,
you
true.
diagnose arthritis? So everyone has joint pain and something at some point of time, but how do you say that this is arthritis, and how do you diagnose it?
Yeah, yeah. So you had a fall, okay, and you experience joint pain, arthritis, that is
Yep.
arthralgia, that is joint. Okay, so arthritis is little bit different. Arthritis is damage to joint due to any reason. Okay, so arthritis can be of many types. Almost 80 to 90 types of arthritis are described in the literature. But the most common ones are of importance is like they are degenerative arthritis or
Okay.
osteoarthritis, the ones which we see in the elderly population. Okay, so 65-year-old gentleman, when he walks with a limp or he has bowing of his knees, so that is classic example of degenerative osteoarthritis. Second most common type of arthritis is rheumatoid arthritis, or in Marathi, as we say, amvat. Okay, so basically, it is an autoimmune disease in which the cells against your body
Okay.
in your body act against the cells in the joint. Okay, so basically, your own body acts against your joints, causing destruction of the joint. So that is rheumatoid arthritis. Another type of arthritis which is very commonly seen is gout. Okay, in that there is a substance known as uric acid which is present in our body. The
Okay.
level of that substance increases, and then it gets deposits into the joints, and which causes pain and inflammation. Okay, so these are the three most common types which we see in the OPD. And there is something known as secondary arthritis. So, secondary arthritis is related to some process which damages the joint. For example, traumatic arthritis. Suppose you had an accident, okay, and the joint got fractured and it was not treated properly. So in that case, there is disturbance in the joint anatomy, and it causes arthritis. Or second example is ligament injury. So many people, while playing, running, they injure their ligaments of the knee or hip joint. They ignore the pain, and gradually the joint gets destroyed. So that is another form of secondary arthritis. So these are
Okay.
some
But
type of arthritis which we commonly see.
excluding the arthritis that might be caused due to accidents and not proper treatment, is
Hmm.
arthritis hereditary?
Hmm. Hmm. Yes, some forms of arthritis they are hereditary, but it doesn't mean that if your parents or your grandparents have arthritis, you will get it. Definitely, you are having a high risk of getting arthritis, but it doesn't mean that each and every one of you will get it if your parents have it. So there is some form of hereditary component, but it's not
Okay.
100%
So
transmitted
we have
due
a
to the
question from the
generation.
audience. It is from Neena ji. She asks,
Yeah.
what does a 50-year-old housewife need regular exercise apart from the chores that they might be doing in their house?
Yeah, so a very good question. So exercise, like irrespective of the age group, exercise in some form is mandatory. So when I get patients in my OPD, so the female patients, they say that we do our daily work and so I don't need exercise. So that is a misconception which must be corrected. There is difference between your daily course and your exercise. Okay, so for a 50, the question asked for a 50-year-old woman, definitely she needs exercise. Firstly, the importance is for general health. So after 50, most of the patients they have diabetes, hypertension, or some other heart condition. So for that, exercise is required. Secondly, for the musculoskeletal system, after 45, 50, what we see is something called as osteoporosis, or the density or the strength of the bones decreases. So to reverse that, or to correct that, definitely some form of exercise is required, but it is advised to do it under some form of supervision or after taking advice from your physiotherapist or your orthopedic surgeon, because not all forms of exercise are suitable for everyone. So it's like you have to choose
Okay.
and
Would
then
you
apply
recommend
it
any
in your day-to-day
supplements?
life.
You said something about bone density right now. Would you recommend that everyone who is over, say, 45 or 50 should
Yeah.
start taking like D3 and calcium supplements, or is that with your doctor's prescription only?
No, everyone doesn't require calcium supplements. So, firstly, it should be under advice of your treating doctor, because excess of calcium and vitamin D can wreak havoc with your kidneys and other organs. Okay, so it should be strictly under supervision. And as long as you are having a balanced and healthy diet and regular exercise, and your lifestyle is devoid of habits like excess alcohol or tobacco, I think most of you should do just fine without any extra supplements. But yes, if at all you need it, you
Okay.
should discuss with your
So,
treating
is there
doctor.
anything that we can do to prevent arthritis? You told us about the causes in terms of how the cartilage and the bone structure changes as we age. But is there anything apart from exercise that we can do to prevent
Mm.
arthritis?
Yeah, so as I said, some forms they are hereditary. Okay, so many of the times you don't have a control. Okay, so even if you do everything in your power to avoid it, it will still happen. Okay, so the important thing is to seek treatment. Okay, whenever you have symptoms of arthritis, that is joint pain, stiffness, swelling, because the earlier it is diagnosed and earlier it is treated, the better will be the response to the treatment. And regarding prevention, having a balanced diet from an early age, right from the childhood, okay, and inculcating habit of exercises, avoiding excess of alcohol or tobacco, and keeping yourself active. Another important point is avoiding excess weight, because if the patient is obese or overweight, it puts an excess burden on his or her joint and bones, which again leads to pain and is a known risk factor for degenerative osteoarthritis. So having your weight under control is also important. And as I said, if at all you have any symptoms,
Okay,
consult
okay.
your doctors
We have
early.
one more question from Mugdha and she asks, what to do at home if someone falls and sustains injury to the bone? So, until you get to the hospital or until an ambulance arrives, what should be the first aid or
Mhm.
something that needs to be done before
Okay.
an actual medical professional can take care of the injury?
Yeah, again, it's a very good question. As like many of the patients in my practice, they are from rural areas. So what happens usually, they go and consult a bone setter, and he applies some forms of cream or lape, as we commonly call it, and they just stretch the bone. I don't know what all things they do, and that's it. They don't consult anybody else, or they massage their joints for pain, which is absolutely wrong. So first couple of things which you remember is, first of all, do not rub the joint, okay, because it can cause very serious consequences. And there is a mnemonic known as rice, okay. So in that we it is basically used to tell the patients what to do in case of emergencies, okay. So it includes ice, okay, application of ice whenever you fall or you have sustained an injury to a bone or a joint. Apply a lot of ice. It reduces swelling, reduces inflammation, okay. And if you have any some form of compression, such as a crepe bandage or even a light bandage or a sling around your upper limb, so apply that. keep your limb elevated. Okay, because because due to gravity, if you keep it down, it is bound to get swollen. Okay, so keep it elevated. If you're expecting or suspecting a fracture, apply any form of splint, even a cardboard or a newspaper or any notebook will also do. Just support your limb with the splint. And if you have any minor painkillers like crocin or brufen, combiflam, you can just take a tablet and wait for the medical
Okay,
person
okay.
to arrive and do the needful.
Actually, there is one more question from the audience, and that was actually going to be my next question as well. Is why are
Yeah.
arthritic people most troubled in cold and monsoon climates?
Okay. So to tell you frankly, the medical community, like still we don't have an appropriate or exact answer. So there are a couple of theories floating around. Like firstly, the pain receptors in our body, that is the cells which send the signals of pain to the brain.
Okay.
They are usually more active in colder climates. Okay. So even though you are experiencing routine pain, the receptors being more sensitive, they feel that.
Dr. Mahajan, I think we have lost you. I can't hear you. Okay, I think we've lost Dr. Mahajan there for a second. Yeah, yeah, I can see you now. Please,
Hello?
please. Yeah, I can hear you well.
Hello? Yeah, yeah. Yes.
Yes, I can hear you, but
Hello?
right,
Hello?
right, right. Please
Yeah,
go
yeah.
ahead.
Okay,
Sorry.
okay. Fine. Yeah. Yeah. So the pain receptors, though even though the pain is normal, the receptors being more sensitive, you feel that there is more pain. Secondly, the muscles are more sensitive in the colder climates. There is something known as
Okay.
muscle spasm. Okay, the muscles stiffen up. So that phenomena is more common in winters or colder climates. So again, because of that, your joints tend to get more inflamed. Okay, so again, you feel a lot of pain in colder climates, and it is something inherently related to a disease. Like in asthma, people of asthma complain that they have more allergic reactions in drier climates or in dusty climates. So basically, the colder climates have a propensity to cause more pain in rheumatoid arthritis. So though exact answer is not known, as I said, it is basically related to the receptors
Okay.
or the
So
anatomy
you
of the
were talking
joints.
about putting a lot of ice
Yeah,
if there is inflammation or swelling or a broken bone.
yeah,
What would you suggest for
yeah.
joint pain and inflammation? So
Yeah.
what is, I mean, when do you use an ice pack and when do you use a hot pack?
Yeah, very good question. See, basically, for this, if you understand the mechanism of action, how ice and heat works, you will like able to answer this question yourself. So, what ice does is basically
Okay.
it constricts your blood vessels. Okay, so whatever blood is coming to your joint, okay, it reduces. Okay, so suppose you have fallen down, and unless you stop the blood flow or you reduce the blood flow, it is bound to get swollen. Okay, so to reduce the inflammation and reduce the blood flow, we apply ice in acutely involved joint. Acute in the sense you have fallen down, you have injured your leg. That is an acute condition. Okay, and
Yeah, yeah,
in
I can hear
even
you.
in
Please,
mornings.
please go ahead.
Hello, can you hear me? Yeah. So in conditions which are acute, you apply ice. You must have seen in cricket or football, whenever a player gets injured, the first
Right,
thing the
right.
physio does is he applies ice. Okay, so that is to reduce the inflammation. Whereas in chronic conditions, suppose you have a chronic back pain or any chronic muscle problem. Okay, so in that case, you apply heat because two things happen in that. The blood flow increases. Okay, so whenever you are taking any medicines, the amount of the medicine reaching that particular muscle increases because of the dilatation of the blood vessels due to heat. So more blood flow reaches, more medicine reaches, and you get relief. Similar thing in stiffness. In some form of arthritis, you have morning stiffness. Many patients say after getting up in the morning, there is a lot of stiffness and swelling. So even in that cases, when you apply heat, the amount of blood flow reaching the joints increase and it helps you feel better. So rule of thumb is in fresh or acute cases, always ice, and in old or
Okay,
chronic
okay.
cases,
I think that
generally heat.
answers my question. Yeah, I see a lot of new people are joining in. So, are there any natural ways of pain management, or is like pharmaceutical medication? Is there something that people can do at their homes apart from ice or heat packs to reduce pain in arthritis? Of
Yeah. Uh, so yes, yeah, yeah. So for mild form of pain, they can be very well managed by natural remedies. So it, as you said, it includes ice or heat. Second is some form of physiotherapies. Okay, so for example, ultrasonic therapy or interferential therapy. So it involves sending some particular wavelengths of electric currents or ultrasonic waves inside the muscles or joints. Okay, so without any medication, you get pain relief. Another good option is exercising your joints. Okay, and thirdly, you can try acupressure. You can try some form of yogas, pranayams. Okay, so that sort of things can be tried, but it is only sufficient for mild form of pain. Okay, so if you are having severe or moderate type of pain, some sort of pharmaceutical help is required at least in initial stages. And once pain subsides, you can continue
okay,
with the
okay.
modulator
And would
already
you
described.
suggest it is?
And
No, please
at
go
the
ahead.
same
Please go
time,
ahead.
it is yeah, at the same time, it is necessary for the patients to know that taking painkillers for even minor sort of pain is harmful in the long run. Okay, so I get many patients who are like almost addicted to the painkillers. They say unless they take that tablet, they are not able to sleep. They are not able to move around the day. So if you are having such sort of chronic pain, it's better to consult a specialist instead of taking it over the counter from the medical store. And in the long term, it will affect your
Of course.
kidneys, livers, and so on. Okay,
Right.
so it is
What is
necessary
your
to
take
keep that in
on
check as well.
massage oils? Do they really have any effect? Do they go into your skin? And do they help in arthritis?
Yeah, see, some form of massage oils, like for example, those containing diclofenac. Okay, so there is some form of penetrability into the joint or into the muscles. Okay, so it is a good modality for mild form of pain, and there is something known as counter irritation. There is a terminology in that. So, example, if somebody falls down, our
Of course.
initial response is to rub that area, right? So that is known as counter irritation because what happens when you rub a particular joint, the touch or the rub sensation overcomes the pain sensation. Okay, so your brain perceives the touch more than it perceives the pain. So that is the basic idea behind all this. So yes, definitely massage, if done properly, it definitely helps. But again, massage, too much massage or too much rubbing the joint can aggravate your condition. And so it's better to do it only after consultation with
Okay.
your
We have
physiotherapist or
a
your
question
orthopedic
from the
surgeon.
audience. Uh, Mrs. Jadhav, I think she asked, do you suggest any specific diet for women after 50, specifically for vegetarians, and to improve calcium? And this is actually what my next question was going to be as well, was what would you say is a good diet to maintain bone health and bone density?
Okay. So like a common misconception in public these days is that if you take just pop in calcium tablets, you won't have any bone or musculoskeletal issues. So though partly it's correct, but the important thing to know is that not only calcium, there are almost 20 to 25 minerals and micronutrients which play a role in bone metabolism. So it is necessary to have a balanced diet. Okay, just focusing on calcium rich food is like not sufficient. So ensure you have a balanced diet of carbohydrates, proteins, fats, minerals, and vitamins. So particularly with calcium, yes, it plays an important role, and it is the most important element involved in the bone metabolism. So in regards to calcium, the good sources are milk and milk products, the paneer, cheese, butter. Green leafy vegetables is again a very good source. And fortified foods. Nowadays, we get foods fortified with calcium and vitamins like our atta or even fruit juices. Nowadays, they're fortified. So as far as possible, try to take these fortified foods in your diet. And calcium is abundantly present in vegetarian sources. The problem arises in vitamin D. Okay, so vitamin D is most commonly available only in non-vegetarian foods. Okay, so fish liver oil, egg yolk. So these are the most important or like, easily available source of vitamin D. But luckily for us in India, we have abundant sunlight. Okay, so for vitamin D, you can just sit in the sun, early morning sun for 20-25 minutes with your legs and hands exposed, and you will get adequate quantities of vitamin D. And particularly for vegetarians, it's necessary to ensure that you get enough exposure of the sunlight. Okay, because low levels of vitamin D not only cause bone pain, but they are also known to cause problems related to heart or even lungs. Okay, and with help of your or with the consultation of your doctor, you can take supplements of vitamin D or calcium intermittently, depending on your condition, your history, or any
Okay,
other
so
symptoms you have.
basically the misconception that vegetarians only have to depend on supplements for their dietary needs of calcium and other micronutrients is not correct, right? Is that's what we agree on?
Yes, yes, yes. Abundantly, you can very well. But I myself, I am a vegan, so there are enough sources, and like with nowadays advent of Google and all, anybody can just search online and see what all foods are suitable for you. Again, the some diets may not be suitable for certain people. Like suppose if you are lactose intolerant, you won't be able to have milk. Okay. So depending on that, you can select whatever you want. So and yes, vegetarians do have a lot of options to keep their
Okay.
bones in a healthy condition.
There is one more question from the audience. This is from Dr. Mahajan. He was actually on our talk before. He's asking what is endoscopy surgery and how do you find it useful in treatment of orthopedic conditions?
Yeah. So endoscopy is a generalized term for keyhole surgery. In for orthopedics, it's known as arthroscopy. So basically, what used to happen for suppose we wanted to say explore the knee joint,
Okay.
okay, for some ligament injury. So earlier we had to open the entire joint. So nowadays, what we do since past 20-25 years, there is something known as the keyhole surgery. In that, suppose this is a model of a knee, so you don't have to open the entire knee. Okay, so there is something known as arthroscope, or in Marathi we call it as a durbin. So we just insert it inside the knee in this way, and it is connected to a TV. So whatever is there inside, we can see it on the TV. And there are equipments or machines or technologies now developed in which we can do a lot of things using this keyhole surgery. So most commonly we can do ligament repairs, we can treat small fractures, we can deal with some cartilage problems, and in some sort of infections, we can treat the infection as well. So the advantages of this is that first of all, the blood loss is minimum. So you can imagine opening the entire joint and just taking a small nick for inserting the arthroscope. So recovery is very fast, blood loss is very minimal. In chances of infection, they are very low, and the patients can start walking from the next day itself. No need to have bed rest or plaster applied to their leg. So definitely, it has revolutionized the practice of orthopedics and particularly sports medicine, because such injuries, sports injuries or ligamentous injuries, they can be very well managed
Wow,
using
that is
arthroscopy
wonderful news
or keyhole surgery.
because I'm sure a lot of people are concerned that if they go to an orthopedic doctor and if there is an issue with the joint, then they have to be treated for 15-20 days or be in bed rest for a month. So I guess this kind of a technology has
Yes.
definitely taken that out of the equation, right? So perfect. So,
Yes,
actually,
yes,
we
yes,
have
yes,
one more
yes.
question
Yeah.
from the audience, but this I'm going to take with one other question I had is what would you like to suggest as exercises that elderly people can do at their homes in this lockdown because they are not allowed to go out and it is risky for them to go out. So, what kind of exercises
Yeah,
would
yeah.
you suggest? And I would like to
Yes, yes,
combine
yes.
that with our audience's question is what is the role of physiotherapy in arthritic patients? So, from a technical viewpoint as well as something that people can do at home.
Yeah. Yeah. So like first thing I would like to say is exercise for every patient or every person is different. Okay. So what is suitable for you may not be suitable for me. So just to give an example, there was a 40-45-year-old female patient who had come to me like a couple of months back. So her history was she had severe pain in her knee. So on asking about the history or detailed inquiry, she told me she had recently taken
Okay.
up Zumba classes. Okay, and she was a obese female, and on her friend's insistence to reduce weight, she had joined Zumba classes. And within like 7 to 8 days, she sustained an injury to her knee, and it was swollen very badly. And on further investigations and examination, she had a broken ligament, and she had to undergo that keyhole surgery, which we talked about. So the point I want to emphasize is what is suitable for you may not be suitable for me. So first of all, it is necessary to get your exercises, discuss it with your physiotherapist or your orthopedic surgeon, list them down, and just do those exercises.
Dr. Mahajan, I think we are losing you again. Okay, go ahead now. Yeah, we can hear you clearly.
Can you hear me? Hello?
Okay. Just hold for 1 second,
Hello?
Dr. Mahajan. I think we have lost your
Can you hear me?
voice and video there. Yeah, please go ahead, doctor. We can hear you now. Yeah.
Yes,
We
can you
can
hear
hear
me?
you. Please go
Yeah.
ahead.
Can
Yeah.
you hear me? Yeah, okay. So in elderly, it is necessary to avoid any rigorous exercises. So the most commonly advised exercise is regular walking, and if it is possible, a stationary cycle which is available in gyms. Okay, so you can just bring it at your home, and cycling and regular walking on your terrace or in your garden is sufficient. And in that you can do yoga, pranayam, which is not causing any pain or difficulty for you. And if you are having any specific problem for your back, for your knees, then it's better to consult an orthopedic surgeon, and he or she will guide you with the exercise options, and those specific exercises you can do it at your home using the guidance. And regarding the second part of the question, yes, physiotherapy does play a role in arthritis. It has basically two mechanism of actions. First of all, it
Okay.
strengthens your muscles. Okay, so in arthritis, what happens due to the rubbing of the joint, which we talked about earlier? So there is pain due to rubbing of the bones against each other. So once your muscles are strengthened, the load on your bones is reduced. Okay, so part of that body weight is taken over by the muscles. Okay, so that is one of the important mechanisms to reduce pain. And secondly, exercise is known to alleviate mild to moderate forms of pain due to release of certain chemicals known
Okay.
as endorphins. Okay, so in that way as well, for your systemic well-being as well, exercise is definitely recommended in arthritis, but it should be all under the guidance of the orthopedic surgeon, as wrong or excessive exercise can aggravate your problem
Okay,
instead of
so that
alleviating it.
basically answers one more question that we had, was that how does what is the importance of sports or general fitness? So it basically improves the musculature and improves the strength in your muscles, thereby reducing the stress on your bones. So I
Yeah,
guess that answers that question. We have one more question from Mr.
yes,
Saxena. So he's an acute
yeah.
patient of osteoarthritis and uses regular painkillers for 4 years now, but he doesn't have any
Okay.
other problems. So, what would be your
Mhm.
advice to him?
Yeah, see, that's a very common question asked by the patients. First of all, you need to know that painkiller is not the treatment of your condition. Okay, it's just
Okay.
symptomatic relief from your pain. Okay, so if you are taking painkillers for 4 years, okay, so that's a quite lot of time. So it's better to consult a specialist as to why your condition is not improving in spite of taking painkillers for 4 years. If you are having a form of arthritis such as rheumatoid arthritis, you can start with a specific treatment for rheumatoid arthritis, and definitely that will be under control. But on the contrary, if you are having degenerative or age-related arthritis, then you might be even needing a knee replacement. So I won't ask you to continue medicines for any longer, because already 4 years is already a lot of time. So better you consult a
Does
doctor
taking
regarding further
painkillers for
treatment
such a
options.
long time cause any tolerance issues in terms of, say, that the dose has to be increased, as well as is there a withdrawal if he stops suddenly?
Yeah, so there are two types of painkillers. First is narcotic group or centrally acting painkillers. So those painkillers, they directly act on your brain. So regarding issue of withdrawal or the tolerance is more commonly seen in those type of painkillers. And those painkillers, they are on taking for a long time, they can definitely cause problems related to brain or your psychology. So it is not at all recommended to take them for more than 1 week. The other type of painkiller is known as peripheral acting, which we commonly take from over the counter. Okay, say Combiflam or
Okay.
Crocin. So they are all acting peripherally. So they don't exhibit tolerance, or addiction with them is not like noted. But what they do is they act on your peripheral organs like kidney, liver, or even on your heart, your stomach. Okay, so they affect multiple organs and they cause problems in that. So it's better not to take. A short course is fine for 5 days, 7 days, 10 days. It's fine. For example, as we discussed in the beginning, so in the cold weathers, many patients come to me with the
Great.
acute flare of their arthritis problems, symptoms. So for them, I advise a short course of painkillers, which is perfectly all right. But a longer one, longer
Okay, okay.
duration, like
Mr.
is not
Saxena,
at all
I think that
recommended.
answers your question. We have one more question from the audience. Does water therapy help in the condition? So in arthritis, as well as after a big joint replacement or some major fracture recovery, doctors usually suggest that you walk in water. How does that really
Uh-huh.
help the
Mm.
body?
Okay. Yeah, basically hydrotherapy is form of strengthening exercise because you are walking
Okay,
in the water, it's against resistance, right? So that is definitely helpful, but you need
okay,
to have certain amount of strength before you try that. Because those who have done swimming in their life, they
of
know
course.
walking in water is a bit difficult than walking on ground. So it's a very good exercise for building resistance or strength in your muscles or joints. But after a certain, it's not indicated in the initial stages, but once you develop basic strength, you can definitely go for it. And it is, unfortunately, in Satara or even in India, such facilities are not easily available. But in Western or in European countries, like when I was there for my training, hydrotherapy is like available in almost every hospital. But due to the expenses related to it's not there, so it's not very popular in India. But yes, if you have the
Okay,
facility, I
wonderful.
would recommend you
So the
can
next
go with it.
question is about replacement. So what is your take on joint replacement? When should a person consider
Yeah.
it? And is there anything that can be done before a person reaches a point
Mhm.
where replacement is the only option left?
Yeah. Yeah. So joint replacement, like it's one of the life turning or life changing surgeries one can undergo. It was even voted as one of the most very impressive or operation which changed the humanity because it was discovered in the second part of the 20th century, and at the beginning of the 21st century there was a polling done in the amongst the surgeons, like which surgery you feel was has revolutionized the medical care. So hip and knee replacement were among the top five
Okay,
surgeries, which was mentioned by all the surgeons who felt that it revolutionized the life of the humans. So what we do in joint replacement is we just change the damaged joint. So this is a normal knee, all right. So this is the bone, this is the cartilage, and this is something known as
right.
meniscus. Okay, a cushioning in between both the joints. And this, I have a model here of a replaced knee. Okay, so as you can see, this is a metallic part, this is a plastic disc in between,
Right.
and this is again a metallic part for the shin bone. So this is the thigh bone, this plastic disc, and this is the shin bone. So this is a replaced joint, so it works normally, okay, as a normal joint would do. So this surgery, it's completely, as I said, it's completely changes your lifestyle. Your pain reduces, any deformity in the knee, it completely goes away. And in 6 to 8 months, the patient, like even he cannot identify whether the knee is original one or an artificial one. So it's a very good surgery, but everything should be taken with a pinch of salt. Not all joint pain should, or not all joint pain or not all form of arthritis require knee replacement. So it is indicated only in end stage or severe stages of arthritis, which your doctor will guide you. But yes, if you require it or if your arthritis is very severe, I would definitely recommend everyone to at least consider it, because your requirement for medications will tremendously go down. Your lifestyle, your mood, and your general attitude to life, it will alter immensely. And being like 70, 80 years old surgery at least, now it's very safe, and the technology is improved so that you can expect almost a full recovery. And regarding second part of your question, what can be done before
Of course.
approaching knee replacement or any joint replacement? So there are three types of arthritis: mild, moderate, and severe. So in the first two types, mild or moderate, you can try for non-surgical options like some medicines or some form of injections or physiotherapy. Okay, and even some minor
Right, right.
surgeries using the keyhole technique, which we talked about, they can help you a lot. Yeah. But in spite of all these treatment options, sometimes the patients experience progression in their symptoms. And in that case, the knee replacement or joint replacement is the only option. But that said, some people improve with just non-surgical management as well. So for them, this surgery is not required, and this surgery is an elective procedure. Okay. So whenever you feel or whenever the patient feels that, no, I cannot carry on any further, or I am taking too many medicines, I need to stop it. So that is the ideal time when you should
Okay,
consider a knee
okay.
replacement
That
or
that
joint
was a
replacement.
very illuminating answer that you gave to our questions. There is one question. So this is a bit technical, and I don't know if our audiences will understand a lot. But if you could just give an answer. So how do you treat
Hmm.
avascular necrosis of hip? It is in the second stage.
Okay.
Yeah,
So
yeah.
avascular necrosis of the hip joint, right? Yeah. So basically, avascular necrosis is like in common man's language, we will call it heart attack of the hip joint. Okay. So the blood supply to the hip joint stops, and because of that, the arthritic process begins in the joint because the cartilage gets destroyed, the bone gets destroyed, and what you have in the end is an extremely painful and a very stiff joint. So stage two is relatively early. We have four stages: one, two, three, four. Stage
Okay.
three and stage four usually require joint replacement. But for stage one and stage two, we can try for some mild form of treatments. There are some medicines available which can retard the progress of this vascular necrosis, and there are some surgeries not as invasive as the joint replacement, which can halt the progress. But that said, progression from one stage to another is it cannot be predicted. Okay, so some people they experience very rapid deterioration, like from stage 2 to stage 3 they can progress within span of few months, and on the other hand I have some patients who have maintained themselves in early stages for years together. So that is difficult to say. Second part of this answer will depend on the patient's diet. First of all, the patient has to stop alcohol because alcohol is a very strong incrementing factor in vascular necrosis. So patient has to stop alcohol, completely stop tobacco, any form of tobacco, either smoking or chewing. Okay. So pan masala, gutka, so whatever contains tobacco, it has to be stopped because both
Okay.
alcohol and tobacco affect blood vessels of the bone. Okay, so that has to be stopped. Certain medicines, okay, like steroids, they are known to cause a vascular necrosis. So if you're taking steroid for any reason, so better consult your doctor whether steroid can be stopped because some people of asthma, some people of rheumatoid arthritis, they are on long-term steroids. So these steroids can cause a vascular necrosis. So discuss with your doctor,
Okay.
and I'm
Wonderful.
sure like they'll be able to help you out. And again physiotherapy, finally physiotherapy for strengthening your muscles, and
Okay.
lifestyle
Nainaji, I
modifications to
think
avoid
that
stress on your
answers
hip.
your question very well. So now I'm going to ask you some questions regarding sports. So, Dr. Mahajan, as you know, a lot of people are participating in
Yeah,
marathons and they are training on pavement, they're running the marathons on
yeah,
pavements or hard surfaces. What care should people take to avoid
yeah.
excess load on their joints as well as wear and tear of bones and their muscles?
Yeah, the first of all, actually, had it not been for the corona
Right,
pandemic,
of
this
course.
would have been the marathon season in Satara, right? Uh, yeah, so since past few years, what we are experiencing is an epidemic of these marathons. Okay, so every city or
Of
every
course.
town is coming up with their own marathons, and even the general public, they have like following it like a religion. So I know many friends of mine or many
Right.
patients who participate in each and every marathon. So first of all, you cannot control on what surfaces you can run. Okay, so that is not in our hands. So what is in your hands is couple of things. Firstly, always invest in a pair of good running shoes. Okay, not for some cheap ones or some fake companies, but good branded running shoes. Okay, from a reputed company. Secondly, you need to get help from a professional, okay, from a trainer who can guide you in this. So I know many patients or many people who are like just relaxing throughout the year, and come July, come August, they start
Right.
running for the September marathon in Satara, and obviously you cannot expect the body to cope up, and it is bound to fail. So they come to me, they say, doctor, please, we have to run for the marathon, just do anything but make us pain free. So it's not miracle. Okay, you cannot expect this to like go away immediately. So ideal thing is to prepare in advance. So select the runs or select the tracks which you want to participate in, and prepare for those tracks only. Don't run blindly in every track or just because your friend is saying let's go. So don't just follow. Select which tracks you want to run and prepare for it at least 6 to 8 months in advance with help of a trainer. And lastly, marathon depends or varies from place to place. For example, running a marathon in Leh Ladakh will differ from running a marathon in Goa. Okay, so the climate, the altitude, the surface, everything is different. So your nutrition or your training should vary accordingly. Okay, so plan in advance as per your fitness or as per your stamina, what is best for you, and then plan properly. Just don't go blindly into the marathons. And I'm sure with this, you can keep the injuries to the minimum. And in spite of that, you can have injuries. So if at all you have that, you seek early treatment so that you can be rehabilitated. And by next year, you are again fit to run. Okay, don't continue even if you're in some people, they
Right,
keep
right.
running or keep practicing even though they are in pain. So that is not advisable. Yeah, even if you miss this year, there is always next year. So better to take care
Thank
of
you.
the
That is
affected joint
wonderful advice.
immediately.
So, continuing with our questions regarding marathons, there are a lot of ACL injuries as well. So, do they all need to be operated? And at what
Okay.
point should an operation be considered? Because we know a lot of people, they'll use a crepe bandage, they'll go to some doctor who will give them herbal medicines. Do they actually
Yeah, yeah,
work
yeah.
in ACL injuries, or is operating the only option?
Yeah. Yeah. Firstly, like to show you the ACL injury.
Right?
So this is the back of the knee joint. Okay.
Yeah, yeah,
And
yeah. Yeah.
this is the ligament. You can see this structure. Yeah, yeah. So there are two ligaments. One is
Okay.
the ACL and one is the PCL. Okay. A for Andhra and P for Pune. So there are two ligaments which are inside the knee joint. So that is the injury which we are talking about. So the ACL injury, as you said, is one of the most
Right.
commonly involved ligaments anywhere in the body. So the treatment will depend on couple of things. Firstly, the age of the patient. Okay, so if a player, if the patient is a sportsman, okay, or if he's an army personnel, or if he's a police guy, so that requires urgent intervention, okay, in form of the surgery. Why surgery? Because generally what happens, the
Okay.
blood supply inside the knee joint is very limited. Okay, so even if you give him the best medicines, best injection, you cannot guarantee what
Okay.
amount of
Okay.
medicines will reach his ligament. Okay, so in young patients, with active patients with a complete tear, okay, surgery is required because without the ACL ligament, you are bound to
Okay.
land up in arthritis. Your knee is bound to get
Okay.
damaged in coming 5, 6, or 10 years. Okay, so that is the one criteria where surgery is must. Second type of patients which we see is partial tear. That is, the ligament is not completely torn; it is only partially torn. So in that case, you can try for some medicines, you can try for some physiotherapy, and in 4 to 6 weeks, we get an idea whether the patient will have improvement or he is not likely to improve. If he is going to improve, well, we can continue it for another 3 to 6 months. But there is no improvement
Okay.
seen, it's better to go for a surgery. And third criteria in this is if the patient is elderly, okay, the patient is above 50, 60, he's just in his home or not very active. So in that case, we can manage him non-operatively because surgery won't be of any great
Okay.
benefit to him
Okay.
because anyways he's not very active or he just stays in his house or his office. Yeah. So treatment depends on the age of the patient, his lifestyle, and the grade of injury. And another factor is any associated injuries, because in many cases, what we see along with the ACL,
Right.
there are some other structures damaged in the knee joint. For
Right.
example, this cushion, this can be damaged. Yeah, there are two ligaments
Right.
which are outside the knee joint, this one and this one. Okay, so sometimes even they can be damaged. So if other associated injuries are present, so we need to take that into consideration as well. So if you have an ACL injury, so or if you suspect that you have some problem with your knee, it's always
Okay.
better to take
Okay.
guidance from an
I guess
orthopedic
that
surgeon. And yeah, and luckily with this ACL injuries, we can completely manage it with the keyhole surgery. So you need not worry about big incision, big scars or infection. So in 2 or 3 sutures, we can manage the entire surgery. So it will be just a 24-hour admission. And in 24 hours, again,
How
you'll be
long
back
is
home and starting with your
how long
exercises.
is the recovery
So
period
very
after
fast
an
recovery.
ACL surgery, and what kind of physiotherapy goes into recovering from an ACL surgery?
Yeah. So roughly for your average job, like suppose you are an office going 9 to 5 job, so you can or suppose you are a private person who's lawyer, doctor,
Okay.
so you can start your work by third or fourth week. Okay, so in 2 to 3 weeks you are completely walking, and by 4 weeks you are able to bend your knee completely. So for practical purposes, by end of 1 month you can start doing your routine course. Okay, and you can start driving your car by 1 month, and you can travel by end of 3 to 4 weeks or 1 month. But the issue is if you are an active person, suppose you are a kabaddi player or you are an army person, you need some extra or vigorous physiotherapy. So that takes around 3 months. So if you are a very active guy, you need to stop all those activities for 3 months. But for any average office going
Okay,
person, you are
okay.
like as good
And
as me by end of 1 month.
what would you suggest is a good way to reduce occurrence of injuries like ACL during sports?
Yeah, so it's coming back to that answer is similar to that marathon question. Good footwear, okay, it has a very like large bearing on the injuries you will have. Secondly, training. Okay, so if you are not trained and if you are trying to engage in a sporting activity, it is bound to cause your knees injury. And so you need to have a good trainer with you. And thirdly, plan whatever. Suppose you want to take up soccer, so it's not that I wake up in the morning and I go for playing soccer. So you need to plan for it, read about it, what exactly it requires from you physically. So if you already have a pre-existing knee problem, okay, so it is not worthwhile taking a very vigorous sport. Okay, so you have to again discuss it with your doctor and what is suitable for your age, your status, your joint status, your weight, your height. So depending on that, you need to decide your sport, and it is the best way to avoid injury. And again, if at all you develop injury, take care of it immediately.
Right,
Don't
right, right.
postpone it
Okay,
till it
so
becomes
there's one more
unbearable.
question from the audience. So now this is, can you advise if I can use a kneecap while brisk walking or running in the morning hours? So, what would you say to that?
Yeah, so basically kneecap is a compression device which you apply it on your knees. It's just like a pair of socks. Okay. The pair of socks you
Right.
apply to your foot, you apply it to your knee. So it gives you a bit of strength because of the compression. You feel your knee is stable. So it's beneficial for patients who have just undergone a surgery, or it's beneficial in patients who have early stage of arthritis. Okay, because it improves the strength or the stability of your knee. But it won't be helpful if you have severe arthritis or your ligament injury or your ligament is completely torn. The kneecap will not not do the work of the ligament. Okay, so initial stages or your post surgery care, kneecap is a very good option, and you can definitely use it. But as I said, for some conditions, it's of no use. Okay, so if you want to try, you can definitely try. And but if you're not
Wonderful.
having any
Thank you
relief,
so
better
much. I
consult a doctor.
think, Rahulji, I think doctor has answered your question. So, doctor, I would not like to take more of your time. It has already been more than an hour since we began the talk, and I know you are a very busy person. So, I would like to thank you very much for coming on Nisarga Talks today and basically giving a lot of useful information to people who are into sports, who have issues with arthritis, who have issues with joint pain. So I'm really glad that we had this talk, and it was a great pleasure to talk to you today.
Yes. Yeah, the pleasure. I would like to thank everyone at Nisarg Hubs for giving me the opportunity to come on your show and like discuss my thoughts with you, everybody. And I wish everyone in your team the best, all the best for your ongoing trial. And I'm sure you will succeed and continue serving
Thank you
everyone
so much, Dr.
in
Mahajan.
Satara and the country
And
as well.
thank you so much, everyone, for joining us in
Yeah.
today. I
Yes.
apologize that my camera disappeared for some reason, but we were here to see and talk with Dr. Mahajan. So everyone was able to see him as well as all the knee joints and the hip joint models that he showed us to give very clear and precise information. So I thank you all. I thank you, Dr. Mahajan. And I will see all of you guys next week on Nisarga Talks. This is Devendra Somar signing out. Thank you so much. Bye. Bye, Dr. Mahajan. Take care. Have a great evening.
Yeah.
Thank you. Bye.